We're back with Dr. Tracy Linhart, Medical Director for Peaks of Health, to talk a little bit about stem cell injections. And I know there's a lot of people talking about stem cells these days. I don't know about you, but I feel like they're
big buzzword.
It is. There's a lot of information. I'm assuming there's a lot of misinformation out there too. So talk about what you're doing at Peaks of Health.
Well, I mean, not only do we do stem cells, I actually teach stem cells. So, you know, it's kind of knowing when to use them, I think, is the big ticket item. You know, we do stem cell injections IV and injectable. And there are different kinds of stem cells you can use. You can derive them from fat called adipocyte stem cells. You can derive them from bone marrow, or you can get umbilical cord stem cells. We use umbilical cord for a couple reasons. One, I don't want to go through a painful procedure, nor do I want to do it on my patient. But the other reason is umbilical cord stem cells are younger, which means they replicate more. I know I don't want to put my stem cells in myself because they're a little older. So, but they're amazing. I mean, I've done them quite a few times on myself along with our patients. My herniated discs in my back are better. The herniated discs in my neck are better. The shoulder biceps tendon where I dislocated and tore it is better. So I've avoided surgery multiple times this way.
I'm kind of worried about what you're doing away from practicing based on all your injuries. You know, you're an avid tennis player, right?
I'm a competitive tennis player, yes.
There you go. Okay. Well, what other, of course, joking aside there, what are some of the other things, though, that people do seek stem cells for? Why do you find yourself bringing them up in conversations to educate people?
Well, and many times it can be a joint injury. It can be herniated discs are stem cells work really well for herniated discs. And then we do IV stem cells for whether it be autoimmune disorders. They're very good for MS and autoimmune disorders. There's studies being done on Alzheimer's and stem cells, which we are participating in. There's studies being done on ALS and stem cells, which I'm watching. Diabetes and stem cells, and we're actually participating in some of that for type 2 diabetes and type 1 diabetes. So, you know, again, we're finding out how many stem cells make a big difference and how often we do them for certain conditions. You know, like joints are like a one and done. But IV, some people do them just for health. I do them every 6 months just for health. I feel amazing with them, and I feel like I can keep up with my pace that way.
You're saying one and done for some of the injuries?
For the injuries, like my shoulder was a quite a bit, significant tear of the biceps tendon. It was one shot and it was done. I was healed in 6 weeks.
And I get the one thing that I really like about you that I've gotten to know over the years is that you get to know your patients. And stem cells, if they come to you and they say, hey, we want to do stem cell, but if that's not right for them, you're going to help point them in the right direction.
Yeah, we consult on the stem cells. Why do you want them? What are you looking for? Because again, it's not right for everybody. You know, if they're looking for like a bone-on-bone osteoarthritis, there's other injections you can do that are going to work much better. They're not going to get the result we want from stem cells.
You know, we started this segment by talking about how it is such a buzzword. When people do come into your office, maybe they don't know the truth, they've got some myths in their head. What do you want people to know out there? What take home would you like when it comes to stem cells for people watching?
Well, again, they're regenerative. You know, we all have stem cells in our body, but as we age, they're older, they're not working as well, they're not stimulated. So you got to trigger them. But the thing is, they heal. So again, if you have something that needs to be healed, they work very well, just if done right.
You were talking about all the different studies that you're a part of. I know that research is a passion for yours, along with educating people. Let's talk about this upcoming seminar and why you want to have these seminars so that you can educate people.
Well, same thing. I teach this to doctors, but so I redid the seminar for patients so that they can get an idea. I like people to know what they're getting into. I don't want them to come in blind. I like to educate them so that they understand not only what they can do, what they expect, and, you know, is this for them? So they can come to the seminar, they can learn all about stem cells, and then they can decide if that's the right thing for them.
I love that. Well, let's go ahead. We're sharing information right now for this free stem cell seminar, October 24th. There's the website. Is that the website where you want people to go to register? Is that a good idea?
That's a good idea. And if you forget to register and you think that day, come on in.
Come on in.
We have plenty of space.
You're not going to turn people away.
No.
Well, as always, we love when you're here. Thank you so much for coming in.
Thank you.